Today, we are going to take a look at a brief overview of the West Nile virus. First, let's explore what West Nile fever is. West Nile fever is an infection by the West Nile virus. West Nile is an arbovirus. Arboviral disease is a general term used to describe infections caused by a group of viruses spread to people by the bite of infected arthropods, insects, such as mosquitoes and ticks. It's an RNA virus in the genus Flavivirus. Similar viruses cause dengue fever, yellow fever and Zika. Why is it called West Nile virus? The virus was first isolated in a woman in the West Nile district of Uganda in 1937. It was identified in birds, like doves and pigeons, in 1953. Before 1997, it was not considered pathogenic for birds, but then, a more virulent strain caused deaths of different bird species, presenting signs of encephalitis and paralysis. How does the West Nile virus spread? West Nile virus is most commonly spread to people by the bite of an infected mosquito. Mosquitoes become infected when they feed on infected birds. Infected mosquitoes then spread West Nile virus to people and other animals by biting them. The incubation period is usually 2 to 6 days after getting bitten, but can be up to 14 days. To date, no human-to-human transmission of WNV through casual contact has been documented, says the WHO. The pathophysiology of West Nile virus involves several steps. West Nile virus enters the human body through the bite of an infected mosquito. The virus initially replicates at the site of inoculation and then spreads to the lymph nodes. After replication, WNV enters the bloodstream, leading to viremia. This allows the virus to disseminate to various organs. Virus can cross the blood-brain barrier, a critical step in the development of neuroinvasive disease. In the central nervous system, virus can cause inflammation and damage to neurons. The immune system's response to virus is crucial in controlling the infection. However, a weak immune response may allow robust viral replication. What are the symptoms of West Nile fever? The disease is asymptomatic in 80% of the infected people. Febrile illness. About 1 in 5 people who are infected develop a fever with other symptoms such as headache, body aches, joint pains, vomiting, diarrhea, or rash. Fatigue and weakness can last for weeks or months. Serious symptoms in a few people. About 1 in 150 people who are infected develop a severe illness affecting the CNS such as encephalitis, inflammation of the brain, or meningitis, inflammation of the membranes that surround the brain and spinal cord. People with certain medical conditions, such as cancer, diabetes, hypertension, kidney disease, and people who have received organ transplants, are also at greater risk. Recovery from severe illness might take several weeks or months. Some effects to the central nervous system might be permanent. Immunity. Most people infected with West Nile virus are believed to have lifelong immunity from getting the disease. Prevention. The best way to prevent West Nile is to protect yourself from mosquito bites. Use insect repellent, wear long-sleeved shirts and pants, and take steps to control mosquitoes indoors and outdoors. What is the treatment for West Nile virus disease? No West Nile virus specific treatment or vaccine is available. Only supportive treatments are given to neuroinvasive patients. Thank you, friends.